Thank you and welcome to Talking Point. Today on the program we shall be having Dr. Yakubu Baba. He is the Acting Registrar, Environmental Health Officers Registration Council of Nigeria, EHORECON. It's my pleasure to meet you, Dr. Yakubu.
Thank you very much for having me.
It's always been on the field all the time. The issue of COVID-19. Let's say, how has this affected our environment? Let's start with that.
Well, thank you very much. We really need to look at this your question from the environmental health perspective. COVID-19 or coronavirus was declared by the WHO as a public health pandemic. And environmental health is also a branch of public health that deal with the protection of life through promotion of hygiene and also controlling those factors that are in the environment that may tend to increase the possibility of spreading communicable diseases, not only COVID-19. And the coronavirus pandemic is one of the diseases that are sanitation related. Let me say in the whole African region and in the temperate region like Nigeria, more than 95% that diseases that are ravaging the population and the citizens are sanitation related diseases. What am I saying? The solution is if you are able to strengthen the environmental health services in our country and also the sub-region, we can be able to drastically reduce the number of incidents and also the number of mortality that occurs as a result of the coronavirus. And let me also, for the sake of emphasis, say most of the measures that are required to put in place to reduce the number and also contain the spreading of coronavirus are environmental health solutions. And one beauty about environmental health, if you are getting it right, you see the indices going down. So if you look at the disease pattern of COVID-19 now, the question is it reducing or is increasing?
Okay, we will come to the issue of whether is it reducing or increasing. Let's take a look at what lies in stake for the forefront fighters. I want to say that the health officers are at the forefront of this fight at the moment.
Yeah.
What is at stake for them in terms of welfare, in terms of provisions, and in terms of care? Because at this point you cannot disintegrate the health officers from even a medical doctor, because they have to, like you said, keep the environment and sanitation clean.
Well, thank you very much. We really need to look at this in a holistic way. Health services is a teamwork where the responsibility of the health officer ends. That's where the medical officer's services begin. And also in an ideal situation, the environmental health services are supposed to be in the front banner. And when the environmental health services have been defeated, then the medical services will be there to back up the environmental health services, because it's a vicious cycle. Let me typically give you a scenario of a diseases that is also sanitation related, like malaria. You look at the vicious cycle. Today you are ill, gets to the hospital, the medical personnel will treat you, and you still come back to the same environment, and you get infected and go back to the hospital again. So now what we are saying is, if there is going to be a breakage in the cycle, the environmental health service is supposed to break the chain, so that it will create a barrier between you and the causative agent that is causing the disease. While the medical doctors, the nurses, are busy managing the cases, the environmental health officers are supposed to be bringing solutions and also managing and taking care of the environment. So you know how complex it is. Like, you know, the component of environment is three. We have the air, we have the water, we have the soil. And whatever disease you acquire, you can get them through this medium, whether it's through the air or through the water or through the soil. In addition, you can get it through the food. But we put water and food at the same because they are all fecal-oral route transmission. So looking at the expectations of environmental health services, the environmental health officers are supposed to be grouped under allowances and remuneration that is given to the medical doctors. I will say we need to really do more as a nation to really strengthen the environmental health services, because that's where the problem is. If we have not strengthened the environmental health services, you can never see the indices of the diseases.
That's where I'm coming to. I'm coming to that question to say, what efforts have we made so far? I'm talking about your parastatal is under the Federal Ministry of Environment. What would you say has been the strategic effort made at this point in time to ensure that there's this consciousness, as you have mentioned?
Well, looking at the global trend, locally we can say in Nigeria, the environmental health services is domiciled in the Ministry of Environment. And for effective achievement of environmental health services, there is need for this interministerial collaboration between the Ministry of Environment and the ministry responsible for health, that's the Ministry of Health. Without that collaboration, without that synergy, Nigerians will not get the optimal result of what we are expecting. In addition, again, environmental health services are community-based services. And the challenge we have, which is based on the constraint of the financial and also the autonomy of the local government. Okay. In places where environmental health is practiced, where we borrow, that's our colonial masters. When you go to places like UK, you see a strong environmental health services at the council level, because environmental health issues are issues that are based in the communities. And if you don't expect everything to be handled by the federal government, so the failure or the success of environmental health services is dependent on the states and also at the local government. So it is important for the local government and the state to see the importance of recruiting these professionals let me say, because of our policy directions and also the psychic of the political elites, they are thinking of employing more medical doctors. Then they're recruiting environmental health officers. Because if you see, based on the statistics we have that is available to us, you see some local government having only 5 environmental health officers at their service. What can they achieve? And also the environmental health services at the local government, in the state and in the federal, we are sensing about 17 components that we are addressing. This 17 component include disease surveillance, health education and promotion, market sanitation, abattoir sanitation, occupational health and safety. Also looking at issue of like even immunization.
Okay.
Looking at issue of sanitation in hospitality industries, premises inspection, waste management. Even in the waste management alone, there is healthcare waste management, which is very important as far as COVID-19.
And that is where my next question
was. As far as COVID-19 is concerned. So how can 5 persons manage about 17 components in a department of environmental health authority? And that's why you see now the Ministry of Agri also is a stakeholder in public health and environmental health. Ministry of Water Resources is equally a stakeholder when it comes to public health, because environmental health is a cross-cutting issues that you need to have this interministerial collaboration for the services to be standardized and also be effective from the federal, state and the local government. One of the modalities the ministry is putting in place is for us to really embark on what we call the assessment and also taking environmental health audit of our isolation camp and the quarantine stations. Why it is so important to the minister is he has seen the tendencies whereby there is possibility of what we call nosocomial transmission, where medical personnel get infected as a result of accident of poor waste management, or as a result of poor lighting, poor ventilation, having not adequate ambient air that will support the patient and also the caregivers. This will go a long way to really know what are the gaps and how we can fill the gaps, so that the isolation centers and the quarantine station will not be a place whereby you go to seek care, and as a result of getting care, you can get another disease, or the medical personnel that are caregivers will be exposed to acquire infection directly or indirectly from the patient. That's one. Also, the minister has signed a regulation which is developed by our sister agency, the National National Environmental Standard Regulation Enforcement Agency. That regulation is a detailed regulation that gives direction how all these PPE can be collected, can be transported, and can be disposed in a sanitary manner. The regulation also stipulated the fines as a result of violation of all this, because it is very important for the ministry to take that proactive measures, looking at the sequence of events in the Presidential Task Force Committee contingency plan for reopening of the lockdown.
Okay.
One of the policies is some of states are also adopting it, using compulsory nose mask before you go out or you go into any public place. With the population of Nigeria, there is a projection that if you are using one face mask repeatedly for 1 week, if there is no contingency plan of management of even this face mask alone, it will be a source of also disaster to Nigerians, because like the essence of having the face mask is for protection, and as you cough or you sneeze, there is that tendency that the germs may be trapped on the mask. So it's not all common, and also there is also tendencies that those that are collecting the waste, if and they are not properly trained, and that's why we are collaborating with Nigeria too, to see how we as regulators, we regulate waste collectors, so that these waste collectors is not everybody that can be licensed to engage in collection of the healthcare waste. And also there is a curriculum based on the arrangement we had, PPE, private-public partnership, to train these waste collectors on more especially the usage, how they can properly use the personal protective equipment, because cleaning services is a very big area. Waste collection is a very big area of practice where innocent Nigerians are engaged, and the ministry, under the leadership of the minister, is trying to protect this vulnerable group, because they are very vulnerable, by first educating them, giving them the basic skills, the basic new technology that they can be able to do their job, with emphasis on the safety of these waste collectors.
Let's take a look at the fact that despite the lockdown, what are your fears? Let's go there first. Assuming the partial lockdown, easing of the partial lockdown in Lagos, and the federal government is also looking at Abuja, perhaps from the 4th. What are your fears as an organization?
Well, I cannot say we have fear, because one, if the environmental health officers will be given opportunity, by our virtue of our training, we can be able to mount what we call environmental health surveillance in high-risk areas where we are anticipating the presence of crowd in such areas. And locally for us, like what I keep on saying, Kano, Port Harcourt, Abuja, and Lagos, that's where we have large number of disposed manpower. If we are able to be utilized, because one hand, you can have the number of the EHOs. Second hand, is the government ready to provide them with the necessary equipment and logistics for them to do their job? Like what I said, the environmental health services are local government responsibility. So, like in Lagos State, let me give kudos to the Lagos State government and the governor, because he is utilizing the environmental health workforce in Lagos State optimally, where you can see a community team of environmental health officers comprising other areas of professionals, including the enforcement officers, under his leadership, are doing what is expected. If Abuja, Lagos, Kano, Port Harcourt will take that policy, there is no fear.
Can you tell us of what effect is the ongoing decontamination of the public government buildings.
Well, thank you very much. The contamination and disinfection is one of the global environmental health measures adopted by the International Federation of Environmental Health as a measures of containment of coronavirus. The decontamination exercise is a national program which was launched by the Minister of Environment under his able leadership, and also activated the states to also follow suit in the decontamination exercise. The purpose and the aim and the objectives of the decontamination is to eliminate, to some extent, the presence of the virus and other microorganisms, we call them germs, that may likely that can likely be acquired by direct or indirect contact with body surfaces, chairs, rail, and other articles that are supposed to be maybe contaminated by the carriers or the active cases of coronavirus. When the minister launched the decontamination, we were able to have a collaborative understanding with the Federal Fire Service, which we map for at the first instance about 998 federal government building and parastatals, which I can say categorically we were able to decontaminate. In the second stage, we also map out another 150, which we have decontaminated. At the last stage in Abuja, because of the policy or the policy pronunciation of the minister that no public place that attract large gathering will be allowed to open without being decontaminated. We can say so far so good. We had a target, and I believe I can say between that period to now, we are able to decontaminate about 257 facilities in Abuja. These facilities are grouped into religious institutions, marketplaces, majorly government offices, and also some streets, and also corridor routes of some estates that have active cases of coronavirus. The Honorable Minister of Environment is going to issue decontamination certificates. What it means is the minister will certify that such facilities are free from COVID-19 and is free for occupation of the FCT residents. Also, the ministry has concluded arrangement to move the team to Lagos to address more especially federal government facilities in Lagos, which include also the Lagos International Airports and possibly some of the aircrafts that are stationed in Lagos. The proposal and the approval of the minister to embark on such assignment covers about 13 international airports that we believe is a corridor route where most of the cases of corona came into the country. So it is part of the measures we are putting in place to really make sure, because we don't want to leave anything to chances. The minister is a thorough person, I believe that's why we are performing excellently under his leadership. And I really want to appreciate and commend him for really standing for environmental health and also standing for Nigeria, because this is the first time even environmental health is coming to the limelight. Let me also say that this decontamination exercise, like what I said earlier, is a national decontamination program and project, and very soon the minister will start reporting the activities of other states, because we are concurrently carrying out the decontamination exercise. As the COVID-19 is escalating, we are also expanding the environmental health services to the other states that are becoming high-risk states. Let me use this opportunity to thank and appreciate our collaborators, more especially we call the Controller General of Fire Service, who has been very supportive. Let me also use this opportunity to commend and thank, on behalf of the Minister, the Inspector General of Police, who readily make available the riot truck for us that we utilized to decontaminate the streets of Abuja. I will not end this interview without really thanking the Honorable Minister of State, who has been very supportive, and my amiable permanent secretary in the Federal Ministry of Environment, who is always there for us. We are happy, and we can say we achieved this because of the leadership style in the ministry. Let me also use this opportunity to sincerely thank the environmental workforce that had been working day and night. You guys are making me proud. You are doing a yeoman job. Thank you very much.
What do you want to say to Nigerians in terms of
what I can say to Nigerians is let me start with the Nigerians first, that this coronavirus is a real disease, and we have seen it coming. It's an enemy of everybody, and there is no overreaction as far as containment of COVID-19 is concerned. If you can use two-face mask, it's not overreaction. If you can wash your hand after every 5 minutes, it's not overreaction. And if you can insist people should not visit you in your house, it's not overreaction. If you decide not to see anybody and create the social distancing policy, it's not overreaction. So what I want to call Nigerians, we need to take a proactive measures at the household level, at the community levels, and also at the district level and at the local government level. Then the states and the federal government can be able to support you. The containment of coronavirus is everybody's responsibility. Everybody has a role to play. So all Nigerians must play their role so that we can be able to defeat this our common enemy.
Thank you very much. And on that note, we want to say a very big thank you to Dr. Yakubu Baba Mohammed, Acting Registrar Environmental Health Officers Registration Council of Nigeria, EHORECON. It's under the Federal Ministry of Environment. I want to say a very big thank you to all of you for watching this program, and remember to follow us on our social media pages. A big thank you to the Big Brother, the Director Media, Kenny, Big Brother Kenny. Thank you, and all your guys. I want to say very big thank you. And that's where we wrap things up on the show today. Please stay with us on the Talking Point and ensure that you make your point count. See you next time.